So welcome to module 2, no, 3. Welcome to module 3. Here we go. So shock, also called hypoperfusion, describes the state of collapse and failure of the cardiovascular system. So more or less, we die from shock. One of the shocks, we will die from one of them. All right? In the early stages, the body attempts to maintain homeostasis. Homeostasis meaning an ideal environment, the right balance, right? As shock progresses, blood circulation slows and eventually ceases. And as I mentioned, if we die from one of the shocks, right? So shock can occur because of a medical or traumatic event, and these are some of them. So please don't have any of them. Now, that's my recommendation, right? And take my recommendation. Right? I don't buy the Harry RL guns. Stay out of the line of fire, right? But poor again, I'm bad these days, right? So perfusion is the circulation. Say again.
No cutlass one. There's no cutlass, no gun.
Cutlass? Alright, even worse. Right? So perfusion is the circulation of an adequate amount of blood to meet the cell's current needs. And we spoke about that in the previous lecture, right? So perfusion is the circulation of the adequate amount of oxygenated blood to meet the cell's current needs. So it's perfused by the circulatory system, and organs, tissue, and cells must have adequate oxygenation or they may die. Right? So oxygen is important. We need to breathe. We need to breathe good air, right? So poor perfusion, also called shock or hypoperfusion, transportation of carbon dioxide out is impaired, which I mentioned earlier is a problem also. So getting the oxygen in is important, also getting the carbon dioxide out is important also. Results in a dangerous buildup of waste products, which may cause cellular damage. Right? Shock refers to a state of collapse and failure of the cardiovascular system that leads to inadequate circulation. So if you don't identify and manage shock quickly, it will be problematic for our patients. And the treatment is very, very, very simple. You remember how to manage shock? How do we manage shock again? You all tell me.
Recovery position and keep the patient.
There's more to that.
Yes, I'm Paul.
And it's not the recovery position. And it's not for a while either. What is the management of shock?
Supine, keep warm, administer oxygen.
And one more.
Administer oxygen.
And one
Transport.
more. Rapid transport. That's what we're talking about, right? So that's how we manage shock. Oxygen position, which is supine or shock position. Keep warm, and diesel or gas, depending on which vehicle you're driving, right? Rapid transport. Very good. Rachel Riley. Rachel, what's the middle name again now? No gag reflex. Rachel, no gag reflex, Riley. Based on the question earlier on, right? It just fitting. Right. So cardiovascular system consists of 3 parts: pump, pipe, and fluid. So one of these things are interfered with and there's a problem. The pump, meaning the heart, the pipes, meaning the vessels or the arteries, and the fluid, which is the blood. So one of these 3 things is affected and causes shock. Always remember that. It's the pump, the pipes, or the fluid. Right? So we went through this in a previous lecture, and we traced a drop of blood, and we noticed. They give you an exam on this now, we ace it. Right? We learn how to try before you buy. We learn that the definition of an artery takes blood away from the heart. Definition of a vein takes blood to the heart. Right? So pump, pipe, fluid. This is the perfusion triangle. Once one of these things are interfered with, there's a problem. So the heart, damage to the heart by disease or injury decrease the ability of the heart to properly function as a pump. So once it's not pumping properly, once the Pentax pump isn't working properly, you may not get water in your house. It's not circulating the water properly. The vessels, if the vessels aren't full, it cannot sustain pressure. If the vessels are dilated, it cannot sustain pressure. If it's damaged, it cannot sustain pressure. Then we have the fluid. If there's no water in the line, we can't get water in the house. You can't circulate nutrients, you can't circulate oxygen, you can't circulate blood, you can't circulate nothing. Right, so pump pipe fluids. When a patient is in shock, one or more of the three parts is not working properly. Right? The blood pressure is the pressure of blood within the vessels at any point in time. We know what is systolic, we know what is diastolic. We spoke about that. So the pulse pressure is the difference between the systolic and the diastolic pressures. Right? So the pulse pressure signifies the amount of force the heart generates with each contraction. So anytime it's less than 25 millimeters of mercury, we can see the patients in shock. So anytime it takes someone's blood pressure, get any practice of measuring the pulse pressure. Anytime it's less than 25 milligrams, with the millimeters for mercury, we know the patient's in shock. Right? So practice that, practice to measure the pulse pressure. Get the blood pressure minus the diastolic from the systolic. Right? So capillary beds, especially veins. So veins are valves, right? So when we have varicose veins, it's because of weak valves. So in the veins, there's weak valves, that blood moves, the valve closes. The valve moves, valve closes, the valve until it reaches where it needs to go. Versus the arteries, which is high pressure system. Right? So the heart pumps it out and it sends through the pipes under pressure. Right? So different things influence the dispensers, heat, cold, and the need for oxygen and waste removal. So these valves are influenced by heat or cold. So sometimes you have cold treatment, warm treatment. When we twist our ankle, do we use warm or cold?
Cool.
Why we use cold?
I don't know.
It keeps the
Constriction, reduce inflammation.
Right, it causes vasoconstriction and reduces edema, reduces swelling. So what happens is that when there's injury, blood rushes to that area to deal with the problem. Everybody rushing to that area. We have a problem down here, but come, let me go down there. And it causes edema, it causes swelling. So when you put a cold press on it, our ice cold application, it causes the vessels to constrict, it causes the sphincters to constrict and reduce the amount of edema. So it reduces the amount of blood going to that area, right? So hormones are triggered when the body senses pressure falling. So remember when he mentioned that there are sensors all over our body that measuring. So once they notice a deficit, right, the brain will be notified most times, and the body will respond accordingly. It will send a chemical messenger or an electrical messenger to influence a change. All right? Keep that in mind. So together, these actions are designed to maintain pressure in the system, sustain perfusion of all vital organs. So our body constantly trying to maintain homeostasis. If it gets cold, we try to warm up a little bit. If it's warm, it tries to get cool a little bit. Right? If we need more pressure in the pipes, the heart rate will increase, the vessels will constrict. So it's always trying to maintain the ideal environment. Right? So shock can result from bleeding, respiratory failure, acute allergic reactions, and overwhelming infection. Right? All these can cause shock. So you talk about the pump, the pipe, and the fluids already. We talk about the pump, the pipe, the fluids, and this is a categorization of the different types of shock. See, breaks up in the pump failure, pipe failure, or fluid failure. Right? So the shocks are broken up into the 3 different categories. So when we're taking fluid, there's hemorrhagic shock and non-hemorrhagic shock. Right? So non-hemorrhagic shock is like dehydration. Right? You don't have enough fluid in the pipe. And hemorrhagic shock, meaning that there's not enough fluid in the pipe because you are bleeding out. Right? Then we go to distributive shock, which falls under pipes. Something is affecting the pipes. When we have significant infection, there's vasodilation to slow down the circulation of the toxins and the poisons. Neurogenic shock, if there's damage to your spine, everything relaxes. Your spine has been compromised, everything relaxes, and the vessels dilate. Anaphylactic shock comes like if it's a poison in our body, everything relaxes again, the vessels get bigger. And psychogenic shock is when you are afraid or stressed out. For example, if someone sticks up behind you and say, blah, 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 and they get frightened, sometimes you might actually black out. Right? Because it's like a sudden paralysis, and everything that relaxes, your vessels relax, your sphincters relax, so you might even soil your underwear because everything that relaxes for a temporary period, right? So usually when people collapse with psychogenic shock, because they're supine, they recover consciousness within a short period of time. Then we have pump failure, like cardiogenic shock or obstructive shock. Tension pneumothorax. The heart can't expand to beat. Cardiac tamponade. Blood is around the heart. There's a difficulty to expand, right? And pulmonary embolism, meaning that a passageway is blocked off and blood isn't being circulated. Right? So these are the different types of shock: cardiogenic shock, obstructive shock, distributive shock, and hypovolemic shock. Right? This is a good thing to remember. So we talk about cardiogenic shock. Right? We spoke about obstructive shock. We spoke about distributive shock. Hypovolemic shock. So the progression of shock, the stages in the progression of shock. Compensated shock. So initially our body tries to compensate. It's like, hey, everything is right now. I'm going to try to compensate and increase whatever I'm doing to compensate for this deficit. It's only so long you can do that for. It will start to decompensate after a while, like everything else. It's only so long you can do it for, if it's not corrected. So decompensated shock meaning late stage when blood pressure is falling. Alright? Adults usually decompensate very slowly. Pediatrics decompensate very rapidly, like it'll fall off the cliff. So they compensate very well. But when it's started to decompensate, it's a very rapid decline. Versus adults, it is gradual. Right, Mark? All right. So after decompensated shock, usually it's irreversible shock. It's a difficult thing to predict in the field. Sometimes people might bounce back, sometimes they won't. But it has a very poor prognosis, right? Meaning that there's a great possibility that they don't recover. So shock management is very, 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 very important that you recognize it and correct it quickly. Right? The life or the outcome of the patient is dependent on it. Right? So when the blood pressure started to drop, that's a late sign. It's not an early sign, it's a late sign because it will be compensating all the time. Once the blood pressure is low, that means it's decompensating. It's a very late sign. Right? So these are some of the things that we have to be cautious about. When we see these injuries, we have to be very, very aggressive because it's suggestive of potential shock. Right? So obstructive shock, cardiac tamponade. Right? We cannot manage that in the field. We just manage shock how we know to manage shock and rapid transportation. Right? Paramedics are trained to do that pericardocentesis, but we don't do it in Trinidad, right? We don't do it in Trinidad because if we don't get it right, it can be problems for us in the field. So it's recommended it happens in a controlled environment. So when there's blood around the heart and the heart is unable to expand properly, we insert a needle and extract the blood from around the heart. We don't do it in the field, right? Tension pneumothorax, we can manage that one, right? Needle decompression, we do that one. That one's a little more safer than treating the cardiac tamponade. Septic shock, we can't treat that in the field. We can give fluid, plenty fluid, as the patient could tolerate, but more or less we manage that in the hospital. Neurogenic shock, of course, spinal cord injury, we immobilize, treat for shock, right, which includes rapid transport. Anaphylactic shock, when we know epinephrine, call ALS backup, treat for shock, rapid transport. Right? Psychogenic shock is an uncomplicated case of fainting. Once the patient collapses, right, and we spoke about that, we can manage that. People collapse all the time at funerals, right? Or someone just surprises them when they collapse, but generally they will recover. So hypovolemic shock, if it's due to hemorrhagic shock, we try to administer fluids or blood. All right, so ALS will help us with that. If it's dehydration, we try to rehydrate the patient accordingly. We try not to give things PO, right? Because it could complicate when it goes to the hospital. The patient could vomit. The patient could be going into surgery. So if you prefer to give it IV or IO, right? Any questions for shock? Sorry.